Okay, I have been wanting to make my YouTube channel or make a podcast, make media for acupuncture for years now. And the time is just feeling right, and I'm ready to dive into this. So, I am an acupuncturist. I'm also an athletic trainer. I'm also an NET practitioner, which utilizes a strong foundation in Chinese medicine. And so I have lots of knowledge about the body, the mind, the spirit, and all of my different modalities and certifications and licensings have led me to this point. So I'm super excited to be talking about this and to be learning and diving deeper myself so I can be teaching you guys. I am hoping to reach other acupuncture students, and I have been a tutor for acupuncture for 3 years now, and so I am wanting to just make this on a platform so it can just be recycled and reused versus me having to sit in my office and tutor in the moment. Um, I believe that acupuncture school is one of the greatest gems out there, and I just don't think that our school prepped many students properly, and I'm really grateful that my studies of athletic training and NET helped supplement acupuncture school. So I'm here to just help fill in the gaps, and I want this first video to be about where your acupuncture degree is going to lead you, because I went to school in Phoenix, Arizona, and it just feels like you don't know what the end game is. And so you're just trying to put all these pieces of this puzzle together, but you don't know what the puzzle is even looking like to help you support this puzzle pieces that you're getting. So I just want to do a great introductory video about acupuncture school and acupuncture and like where this is going to lead you and like what you can do with it. So, welcome to the first day of class. Here we go. So, ultimately, I truly believe that acupuncture can help heal so much of your body. It personally helped me as well, and so I know wholeheartedly that this is one of the best modalities you could be using. And this is going to even be broader than just acupuncture. We always say it's acupuncture school, but it's really Chinese medicine school, because we're going to be talking about exercise, we're going to be talking about diet, we're going to be talking about lifestyle, we're going to be talking about emotions, we're going to be talking about everything. Okay? And that is traditional medicine. Traditional medicine becomes a lifestyle. And so I try to implement traditional medicine into my daily life, into my family's daily lives, into even my friends' daily lives, and especially my patients' daily lives. And so we want them to be encompassing and embodying this. And so, as the practitioner, we're going to just go through the basics of everything and get you learning more and more as we go. So, I am going to put up some slides of just things that we need to talk about. So, here we go. Okay, so in one of the very first classes of acupuncture school, you're going to be starting to learn about the yin and the yang. And so that's going to be the white and black circle. I'll insert that. And this is going to be one of the key theories of Chinese medicine. And the theory is that there's a mountain, and it's shaded on one side and bright and sunny on the other. And so you can know that the sun is coming in, creating light, and then on the other side of the mountain there's darkness. And so think about thousands of years ago, everything was based off of nature. And that's how acupuncture still is. And so, one of the key things about the body and how everything is changing in the body is that your body is a garden, and however the sun and the rain are affecting your garden, then that is going to be how disease manifests in your body. Okay? So, if you have too much sun, too much heat in your body, then you might have a lot of symptoms that are correlated to heat and inflammation, whether that's acne, whether that's arthritis, whether that's constipation. You can see this as like heat building up into the body, and it could be red, pus, skin, acne, or it could be in the intestines and it's just drying up all the mucous membranes of the body, and now we have like this dryness in our intestines. So if you just kind of keep it very simple, those are just like very common examples of heat in the body. We could also have too much cold in the body, and that could also be arthritis. You know, people say all the time, I can tell when a storm is coming because their joints start to hurt because their body already has all of this water and moisture and pressure in their body. And now, when it comes into the actual atmosphere, their body feels it even more, and now their body can't tolerate it. So that's heat, that's cold, but we also have dryness. So, again, going back into the intestines, too much heat can lead to too much dryness. I live in Phoenix. It's very hot, it's very dry here. You see a lot of people always working on their wrinkles and trying to stay hydrated. And that again goes into like constipation, inflammation, a lot of inflammatory diseases out here because there's just so much dryness. And so we also have too much moisture or dampness or humidity. And so if you're from the Midwest or the East Coast, all this humidity can also start to build up. And maybe we're just super round, super puffy everywhere. You can just feel people's arm and they just have like edema in it. All of that would be too much moisture just built up in the body. Maybe their intestines, they have diarrhea. And so now again, it's literally too much water in the stool. And so their body is flushing it out. So we have these physical environments. So I'm in Phoenix versus the Midwest, different environments, but also our food and our fluids that we're intaking and our herbs or spices that we're consuming, that's all going to play a role in our internal environment. So we have our physical or external environment along with our internal environment. So again, we have heat, we have cold, we have dryness, we have dampness, and we also have wind. So wind is a big part of nature. We see tsunamis and we have haboobs here in Arizona. Like all of this wind plays a part. Tornadoes playing a role in like actual nature. And so when we think about wind in the body, that is going to be like shaking. So that could be our Parkinson's, possibly our strokes or tremors, anything like that. That would be a role of clearing wind out of the body. So these are just brief overviews of how we can see this, right? So number one day in class, I'm sure you're going to learn about the yin and yang, and that's based on nature. Again, it's the sunny side of the mountain versus the dark side of the mountain. And there's dynamic movement in that. So it's not just like the static change, but it's always changing and moving. And that's why we have the white or the light in the darkness, and we have the darkness in the light, because it's ever moving and changing. Another just brief thing that I want to chat about is how to hold a needle. So again, I'm sure this is going to be in one of your first days of class. We have something called clean needle technique, and you will be tested on clean needle technique before you can sit for your acupuncture board exams. And this is a nationwide exam. Everybody has to take this, everybody has to pass this, because we got to make sure that we know how to hold a needle, how to discard a needle, how to wash our hands. It's basics, but people use this, okay? I studied in Taiwan last fall, and it was actually shocking how they don't have a clean needle practice. So practitioners would use a needle inside the body, put the needle onto the table that the patient was laying on, pick it back up, put it into another part of the body. Everything about that is not clean needle technique. And then the practitioner would also never wash his hands. So, of course, this is just one practitioner who was like putting it on the table and then putting it back into the body. But overall, in Taiwan, most practitioners did not wash their hands in between every patient. They did not they didn't use alcohol to clean the points. There's just different things like that. So there's a lot of opportunity that we can be talking about this and like going in depth. But I know that the clinical supervisors will also be like hounding this because this is such a key thing that needs to be focused on. Okay, so I'm sure you'll also be learning about your meridians. This is like the most exciting part in Chinese medicine, is seeing the little acupuncture doll and balancing that all out and learning all about the meridians. So the meridians are going to be these huge energy highways. They are transferring energy, which we could say that's qi, we could say that's our life force, we could say that's blood, that's our oxygen. Nonetheless, it's just constantly moving throughout the whole body. And if we have a blockage in our meridian or that energy highway, all of a sudden the highway will be blocked and everybody's forced to get off of an exit, right? So, using the metaphor of a highway, if there's a car accident, you just get off onto the next exit to bypass that, maybe. So that's how the body can be too. So if one day you just wake up and you have a lot of pain and tension randomly, maybe you just have a blockage in that highway, and through acupressure and gua sha or cupping, there's so many other tools we could be using than just acupuncture, but now you can remove that blockage in your meridian. So ultimately, any blockage, if we have that long term or short term, will start to create imbalances and diseases in the body. So within acupuncture, disease is ever changing. So going back to the dynamic yin and yang, things are always moving, changing, it's dynamic. We can chase it and change it quite quickly. So like how effective our treatments will be is based off of many things. So again, our lifestyle, our age, the onset of the condition, and our lifestyle habits. So are we alcoholics? Are we smoking weed? Like, what are we doing? Are we drug abusers? All of that is going to play a role. Do we exercise? What's our diet like? There's so many factors in all of this. What's your emotions like? Do you want to get better? All of that. It all plays a role in your healing journey, okay? And so, how we can help diagnose how many treatments we need to do is through our diagnosis of 10 questions. And Chinese medicine teaches us as the 10 questions, but as a Western practitioner of athletic training, we would just call this like the OPQRST. So this is your, your onset. I don't have it memorized anymore. I kind of like mix in my mind. I like have things mixed up, right? But this is again really going to be like the onset, the quality. Does it radiate? What time of day does it hurt? What's your scale of pain or discomfort? What's the type of quality of issues you're having? Does it change your quality of life? All of that is going to play a role. In Chinese medicine, we would be asking the OPQRST on every review of systems. So again, I'm trying to tie in Western to Chinese medicine. So Western medicine has this review of systems, and it's going to just start from the head. Do you have any issues with your head? Any issues with your eyes, ears, nose, throat? And we're going to talk all about it. And we're just going to move down. What about your chest? Do you have palpitations? Do you have anxiety? Can you feel that in your chest? Do you have shortness of breath, a cough, asthma? And then we're going to go down into the digestion and so on. So then digestion, and then into our bowel movements, and then into our urinary, into our sex life, and just asking, like, do you have trouble with any of these things? Let's talk it out and let's review all of the systems to figure out what we need to do. So Chinese medicine teaches this as a 10 questions, but it's much more than just 10 questions. It's 10 systems that we are truly reviewing, okay? And so if you can just picture you just working your way down the body, then you can easily pick up where we're going to be asking the questions and like how to be asking the proper questions. Also within the diagnosis, we have tongue and pulse, and this is a very specific thing to Chinese medicine because tongue and pulse will be able to tell your body what is going on if the practitioner does not want to talk to you. So I've had many patients who don't want to talk to me because I'm young, I'm a female, they don't feel good. Maybe they're just not into this. Their parents brought them and they just don't get it. So they're not really wanting to open up about the review of the systems or those 10 questions. And so taking the pulse and looking at the tongue will be a key way as a practitioner to understand what is happening in your patient's body. The tongue, we're looking at the shape, the color, the just the whole consistency of like what the tongue looks like, okay? And then with the pulses, we're going to be, so it's not just like feeling a pulse of like, yep, like you have a heart rate. We do want to know the heart rate as well, but we're actually like feeling it on 3 different levels. And then you can like be pressing on like one level and then pressing down and then pressing down. So there's 3 levels within each spot. So like 9 levels really, right? And so all of that is going to be playing a role because in each position that your finger lays is an organ. So you have your heart, you have your liver, and then you're going to have your kidneys. And so you can just be feeling all of that going down. And then on your other hand, you'd have your lungs, your stomach, and then again your kidneys and your bladder. So your body is going to be able to communicate, and you can also be palpating the meridians to also try to figure out like what is going on in the body if your patient doesn't want to be talking to you. So these are just ways to bring everything together, okay? You should not diagnose just off of one thing, but all encompassing. But we'll get there. This is our Chinese medicine overview of like what is school doing for us and like how are we going to be learning, okay? So we understand our nature. That's our like theory of Chinese medicine. We understand the meridians, and then within the meridians there's the exits of those highway energies, and that's going to be our acupuncture points. We can diagnose through the review of the systems, the 10 questions, through the tongue, the pulse. All of these matter. And now we could go into treatment principles. And there's many different types of principles we have. So it ranges from 5 element, where we're truly staying within nature. We could go Wen Bing, which is all focused on the heat of the body and different layers of heat. We could focus on Sheng Han Lun, which is based off of the cold in the body and like how the cold is transforming to create disease. We could look at Zong Fu. I love channel theory. We can just look at channel theory. There's all these different ways of learning how to diagnose and then creating treatment principles within those diagnoses. And that's towards like the end or the middle of your degree and everything. And so once you're diagnosing and you know which points you're going to be using, then you can also decide, does this person need cupping or gua sha or tuina? Do they need diet recommendations? Do they need exercise recommendations? Sleeping patterns need a shift, so how can we help shift that? We talk about all of that. And then of course, how often does a patient need to be coming in? That's going to be, again, all about lifestyle and what are they eating, what are they drinking, are they exercising, or what's their stress levels, everything. What's the onset of the condition? So there's so many things that we could be really honing in on, but just know I'm going to make videos about all of this, and we're going to just like continue to dive in deeper and deeper of what and how we can be healing the body with and how we do it with acupuncture and Chinese medicine. So stay along, follow the journey, and we're going to hone in on all of it. So again, my name is Dr. Mikkel Andrean. I live here in Phoenix, and let me know if you have any questions.